bring yourselves on out if you haven't received a vaccination for either the flu or for COVID-19 vaccines. Meharry Medical College will be providing on the inside vaccinations, which will include the Pfizer and Johnson & Johnson vaccines, COVID-19 vaccines. We have a lot of questions to ask on both of these vaccines, these vaccination processes, so we will get that kicked off after a quick introduction from our panelists. So I want to, without further ado, turn over to our guest for the evening, who will be leading us through this hour and informing us as a community on important that's relevant and that's important to us. So to kick this off, I'm going to have actually Vanderbilt. Dr. Williams, I'm going to have you introduce yourself first, followed by the Meharry Medical College staff to follow up with introductions. I'll ask that you, just for the hour that we have, keep it brief to your experience in the field, and then also why you felt it was important to be here tonight on this topic.
Hi, everyone. I'm Elizabeth Williams. I'm a pediatrician, and I work at Vanderbilt Primary Care Clinic in downtown Nashville. And so I might take care of some of your kids who are out there, or I look after the residents who take care of your kids. So my experience is that I've been a pediatrician for almost 15 years, and most of the time that I've been a pediatrician, I've been at Vanderbilt. I was in private practice for a couple of years, and through my role at Vanderbilt, I've done a lot with vaccine education both for families and for our learners that we train at Vanderbilt, which are the resident doctors, which help take care of your kids, and our medical students that we're training how to become good doctors. And I've also worked with the CDC in a program called CISA, where we look at safety events that occur after vaccines and try to determine whether or not those events that occur after a vaccine are really related to the vaccine. So I know a lot about how the vaccine safety events, reporting systems and evaluation systems work in our country, and I've worked with them for several years, and so I have a lot of understanding and confidence in how safe and effective vaccines are through all of that work, and I'm happy to be here, and I hope to see a bunch of people on Saturday.
Thank you so much. Dr. Williams.
Good evening. I'm Dr. Paul Juarez. I'm professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College. I'm also director of our Health Disparities Research Center of Excellence and principal investigator for the Tennessee Community Engaged Alliance Against COVID-19, better known as the Tennessee SEAL. My interest in terms of COVID is really stemmed from our research and work in health disparities, and it's recognizing that people of color and medically underserved communities are those at greatest risk, and that these populations frequently don't have the ready access through the traditional health system to receive the information and the vaccine. So again, this is part of the Tennessee SEAL effort. We try to coordinate vaccine education, testing, and vaccine at community events. We go into work with churches and other community organizations across the state to ensure that people have ready access to vaccines in their community. So thank you.
All right, thank you, Dr. Juarez.
Good evening, my name is Donald Alcindor. I'm an associate professor in immunology, physiology, microbiology at Meharry Medical College. I'm also an associate adjunct professor at Vanderbilt in the Department of Infectious Diseases. I'm FDA. I've worked on the FDA for a while, the anti-drug advisory committees, and so I've learned a lot about viruses over the years. I'm a molecular virologist by training, and I sit on the American Lung Association COVID-19 Expert Advisory Committee. I also sit on their advisory board as well. My interest in COVID-19 goes way back from my interest in Zika virus, another virus that thought would be an epidemic, was an epidemic for a short time, but COVID-19 did something that Zika virus did not do. It didn't go away. And so I've also developed a drug in the laboratories at Meharry to affect the COVID-19 virus that we're very excited about. And I also participate in community engagement and dissemination events at Vanderbilt and Meharry. And pass it on.
Oxendorf.
Well, I'm that kind of old man up here. I'm a retired family doctor, trained at Meharry in the very department that Dr. Juarez is in now. And I was invited to come and be a part of a community activist kind of an advocate part of Tennessee SEAL. And I consider myself a health advocate now in my retirement years. And so I'm trained in family medicine and had an early interest in public health. And what I would say now in summary, that I'm more expert in the context in which medicine has to be practiced.
Beautiful. Thank you so much, Dr. Lee, for coming out this way. Thank you to each of you doctors. And as I said, my name is Eric Cox. I am excited to host this event here at Ray of Hope Community Church. You might be asking, Eric, why do we even host sessions like this, Q&As? Why the free offerings on a weekend as well as the church to follow up from the Q&A? And the answer is simple, and that is this is a justice issue. It's an equity issue. And so we as a church want to be the central hub, or at least a hub in the community for information that is relevant, that is important, and that for sure impacts you in this community. So let us go ahead and get started with the event in terms of questions. This will be broken down into 3 rounds. So round 1 will be a focus on all things flu. Round 2, we're going to turn the tables and talk about COVID-19 and COVID-19 vaccinations. And then lastly, round 3 is going to come from you. It is our audience. So as we go through round 1 and round 2, I want you to begin to garner your questions that you would love to hear answered live by these doctors, these experts in the field. And that will wrap up our night. And then, of course, we'll follow up on Saturday with the on-site vaccination offerings as I have described. Let's go ahead and get started. So kicking off first for round 1, all things coming to you, Dr. Williams. In terms of the flu, let's start off with just some softball questions. What is the flu?
So the flu is an illness that you get from the influenza virus. So it's a specific collection of symptoms that you get from a specific virus. Now there's different subtypes of the virus, but the flu, getting the actual flu, is always related to the influenza virus.
Thank you so much for that. Coming in for question 2, Doctor. When it comes to the flu, and I know some people, believe in getting vaccinated for the flu, some don't. So for you, if you could just address the community, why is the flu such a big deal?
So there's a lot of, I think, misconception among our patients and just the population in general about what the flu actually means. What does it mean to have the flu? I think a lot of people will say they have the flu and think they have the flu when they have just a common cold. When in actuality, if you have the real flu, which is caused by influenza virus, it's a much different beast because it's much more severe. You're much more likely to have severe complications if you have the real flu caused by influenza virus. You're much more likely to be hospitalized, and if you have higher risk conditions, then you're much more likely to have hospitalization or some severe consequences that can result in death. So influenza is, you can think of it as a really bad virus. Now we also have COVID-19, which is also a really bad virus, but influenza has been around before COVID-19 and is a severe enough virus that we have vaccines for it every year to try to protect ourselves and our family members and community members to prevent them from getting the actual flu.
Perfect. Thank you so much. To follow up from that, so if you could describe what is the flu vaccine, and then year after year, how do you determine which strains of that get into the vaccine?
Yeah, so that's what's different about the flu vaccine compared to other vaccines is that the influenza viruses can actually change or mutate. And so every year there's groups of virologists and epidemiologists that come together and they assess in the lab what is circulating in the different parts of the world. And I believe it always starts in Australia. So we look at what viruses, which subtypes of the flu are circulating, and they have to make a decision. Okay, these are the most common subtypes that are circulating, and these are the most severe. So these are the 3 or 4 subtypes that we're going to grow and put into the flu vaccine for this upcoming season. So it's really, it's an educated guess, but it is still a guess because we can't say 100% for certain what's going to be circulating by the time the flu season gets here to the United States, and we already have all of our flu vaccines made. And so that's how we determine you have to plan ahead in order to develop the vaccines for the upcoming flu season. So it's not 100% accurate all the time, but we do the very best we can to make sure that we're targeting what we think is going to be out there in the community.
Okay, thank you so much for that. And a follow-up to that question then, which I think I almost grabbed the answer as you were speaking, but why do people still get the flu who've had the flu vaccine?
So there's different reasons for this. First of all, it takes about 2 weeks for you to be protected, similar to what we've heard from the COVID-19 vaccine. You don't really develop your immunity against the virus until about 2 weeks after you've had that injection. So it's very similar to the flu vaccine. So you don't really get protection from the flu with your flu vaccine until about 2 weeks after you have the vaccine. And so that's one reason. If you come into contact with the flu and it has been less than 2 weeks, you could still get the flu. And then the other reason that you were talking about is that there may be a strain circulating that's not protected with the vaccine that you've given. So sometimes the vaccine is really, really good, like 60, 70, 80% effective, and sometimes it's not that good, like 40, 50% effective. And so it just depends on the year how good we are at picking and understanding what viruses are going to be circulating or going to be at risk for your family in that season. So you could pick up a strain that's not in the actual vaccine that you get. But one thing that we do know we have a lot of evidence for is that even if you get one of those strains that's not in the vaccine, you still have protection from your flu vaccine. You're still going to have less severe disease, less risk of hospitalization, less risk of death. And so even though it may not be a perfect match, it's still a very good thing to get, regardless of how accurate we are, or not myself, but the people who are developing the vaccines are thinking ahead and being able to have that educated guess. And then one other thing that I don't think I added to the first question is a common thing that I hear is something called the stomach flu. People think that they have something called the stomach flu, which is it's also caused, when people say the stomach flu, you're thinking of like vomiting, diarrheal illness, usually fever, maybe not feeling so well. And that's also caused by a virus, 100%, but it's not caused usually, almost greater than 90% of the time, by influenza. That is caused by another virus that is not protected, you're not protected against with the flu vaccine. We don't really have vaccines that I know of that protect against those stomach bugs, those stomach flu. So that's what people say in the community and even in my family, but it's not, stomach flu is not influenza. You are not protected against that with the flu vaccine.
Gotcha. Thank you for that clarity.
Yeah.
Yeah, I've definitely called it the stomach flu
Yeah.
as well, so I appreciate that that education. Let's see here. So we're in November now. When is the best time to get the flu vaccine?
I think the best time to get it is as soon as you can get it in your arm, because as I mentioned, it takes about 2 weeks for that flu vaccine to be effective, and we don't really know when flu season is going to hit. Usually it's around end of December, I think early January in Nashville, but we're always just guessing. We don't really know what it's going to do. So the earlier you can protect yourself or protect your family members, the better off you are. And especially if you have young kids, because if you're less than 9, if you have a kid that's less than 9, then they're going to need 2 flu vaccines that season to be protected. So the way we remember it in pediatrics is less than 9, remember to prime. And so if you need to have 2 vaccines to be protected that season, then it's better to just go ahead and get dose 1, and then 4 weeks later or any time after that you can get dose 2, and you're protected for that year. And then forever afterwards, you just need 1 a year.
Perfect. Thank you so much for that. Are there groups of people who should not get the vaccine?
It's very limited reasons that you don't need the vaccine. First of all, if you're less than 6 months old, this vaccine is not for you. It's not approved for you. It hasn't been tested for safety or effectiveness in kids who are less than 6 months old, so babies shouldn't get it. If you've ever had an allergic reaction to the vaccine or any of the components of the vaccine, you shouldn't get it. Of course, nobody wants to give something to somebody that has an allergy to that substance. And then there's also like a precaution if you've had something called Guillain-Barré syndrome. Most people probably haven't even heard of Guillain-Barré syndrome. It's a very rare neurological disease that was associated with one of the flu vaccines in 1976. In 1976, there was another swine flu. People probably remember the swine flu of 2009. Well, there was another swine flu in 1976, and there was some connection between that vaccine and development of this neurological condition called Guillain-Barré syndrome. Now people question whether or not there's a true association with that vaccine, but I won't get into that. But just because of that 1 year where there might have been an association, if you've ever had Guillain-Barré syndrome, it's a precaution, and you should just talk to your doctor about it before getting the vaccine.
Thank you for that. And then with the flu vaccine, are there any, and if yes, are there any risks? And if yes, what are the risks for getting the flu vaccine?
Just like any medication or anything you eat or any buzzing bees around, there's always a risk of an allergic reaction to any substance that you put in your body. So that's always a risk for everything, peanuts, anything. But that's very rare. In my years of practice, I haven't seen anyone have anaphylaxis, a severe allergy to any flu vaccines, and we've given a lot of flu vaccines to kids. So that is the biggest, scariest risk. Other than that, it's just side effects that you would expect. So like a sore arm, or maybe feeling like a little bit run down the next day, maybe having a mild fever. That's pretty much it. It's very well tolerated.
Okay, and two more questions to wrap up this round here. Who's the flu most important for?
Well,
If there's a group of people.
I think it's most important for everyone, but if I have to really target people, it's people who have conditions that make them at higher risk of either coming in contact with the flu or having severe secondary effects from getting influenza. And so that's anyone who has any sort of chronic lung diseases, including asthma, and that's our biggest population of kids with lung problems that we see are asthmatics. If you're an asthmatic, you're much more likely to be hospitalized with complications from the flu. Anyone who has any other sort of immune system issues that you're worried about, if your immune system is not working well enough, or if you're on a medication that sort of knocks down your immune system, then we would definitely want you to be vaccinated. Our infants are at higher risk for severe disease because they're so young and because their immune systems are still learning. And so they're generally a little bit immunocompromised compared to the rest of the population anyway. Our elderly are also more immunocompromised than the rest of the population, and they have a different strain, or a different type of flu vaccine now for our elderly population to try to increase their immunity against the flu when they get vaccinated. And anyone else who has any sort of chronic diseases, so chronic kidney problems or any sort of complex medical history, those are all big reasons to get the flu vaccine.
Thank you for that. And just to clarify, when you say elderly, is that 60 and older, 65 and older?
65 and older, I think.
Okay, all right, beautiful. Last one, this might need a little context in behind it, so I'll ask you to kind of explain more here. But a question of, can I give the flu vaccine to someone who is allergic to eggs?
Yes, you can. There was a time, because the way that they make the flu vaccine is they actually grow the virus in chicken eggs. And so so when you have the flu vaccine, there's like a very small amount of albumin, the white part of the egg, in the vaccine. And so people were concerned about a risk of anaphylaxis or severe allergy if you have an allergy to eggs. But now, essentially, the allergists, the people in charge of all of the allergists, we've looked at this for so long, and it's such a small amount that unless you've had a reaction to an actual vaccine before, there's just no reason to not get the flu vaccine if you're allergic to eggs. So we can just take that out of our belief system anymore, because it's just not a concern anymore for pediatric patients.
Good. Thanks so much for that clarity. All right, that wraps up round one with Vanderbilt on the topic of the flu. Now, as I mentioned earlier, if you weren't a part, and I'll give you a quick rundown of kind of what we're doing if you're just joining us. But round one, we've just finished. If you have any other questions that you didn't hear covered live from Dr. Williams, please send those questions in virtually at the end, which will be round three. We'll cover some of those questions live. So welcome to those who may have just joined. I'm Eric Cox. I'm the Director of Outreach here at Ray of Hope Community Church, located at 2311 Murfreesboro Pike, where our pastors are Martin L. Espinoza and Reverend Dr. Renita J. Weems. We are having what we title the Health Equity Initiative, a Q&A session. It's a two-part session, but a Q&A session with Vanderbilt Children's Hospital, as well as Meharry Medical College, and our esteemed guest here from both of those divisions. Now, tonight is the Q&A session. This coming Saturday, November the 13th, from 10 a.m. to 2 p.m., here at Ray of Hope Community Church, we will provide offerings from Vanderbilt Children's Hospital as well as Meharry Medical College. So we will provide the flu vaccine for children who are 6 months of age up to 21 years of age. And they are even giving away free diapers. Is that right, Eric? Free diapers? Yes, free diapers to those who come out and get vaccinated. Nashville Public Library will also be on site here providing story time for the youth. So that's Vanderbilt. They'll be outside in the parking lot in their mobile flu van. So you'll see signs throughout Murfreesboro, a pipe leading you here. So just come on Saturday, and then also share that news. Meharry Medical College will be here. We'll have staff here providing the COVID-19 vaccinations. The two offerings that they will provide are Johnson & Johnson vaccine and the Pfizer COVID-19 vaccine. All right, round two. So round one was Vanderbilt talking about the flu. Round two, we're going to educate you on COVID-19 vaccinations. I'm going to stop talking, turn it right over to Dr. Borez. The way we're going to work this out, we have 3 doctors from Meharry Medical College. I'm going to ask each a question at a time, and we will just kind of keep running through until we end out round two. So let's go ahead and get started. So Dr. Juarez, first question to you. Why do children need to get vaccinated since their response to getting COVID tends to be mild compared to adults?
Thank you, Mr. Cox. Again, young children need to be vaccinated, not just because they can get COVID and end up in the hospital or die. There have been about 200 children nationally that have died from COVID. A large percent of young children, do not have any pre-existing conditions. So it's almost like Russian roulette. It's you don't know if your child may have a severe reaction to COVID that warrants hospitalization or that could lead to death. But beyond that, it's really important for young children to be vaccinated, particularly as we come into this colder weather and approaching the holidays, because families are going to be gathering indoors, and children can have COVID, and nobody can necessarily is aware that they have it. They don't necessarily have display the same symptoms. And so, again, they can take it back to their homes and infect persons who are not vaccinated. But in addition, we now know that there's quite a large number of persons that have breakthrough cases from the Delta variant. And so those persons are at risk as well. So it's better, again, in terms of being protecting both the child and the family members to get them vaccinated.
Thank you so much for that, Dr. Juarez. Dr. Lee, coming to you. First question here, why are some health professionals against the vaccine?
Well, I hope that some of our health professionals here would help me with this, but I have been very fascinated lately about how health professionals, my colleagues, who are resistant against the science of vaccinations. And so when I try to imagine me, right, when I was coming through and new innovations would come out, sometimes I did not have time to really read and really get, but I trusted the science because I knew a little bit about science. I think what's happening now is our health profession has been politicized. The other thing that we don't think about is it has been corporatized. And so when we look at what is the interest of politicians, well, if they want to be supported by the constituency, and the constituency is vaccine suspicious, they're going to reflect the constituency. On the other hand, we have the corporatization of medicine that has been more oriented toward the shareholder. And a part of that we saw in the 80s when we were worried about, the loss of private practice, the solo practitioner who came into the classic. I'm in the generation who made the transition from the classic, solo practitioner to corporate, to what I thought was great things around the government, Great Society program, health centers, ambulatory care. That was my thing. I loved that. And so I saw that as a great opportunity. But some of that, I would say, the structure of that and some of the efficiencies that brought in was taken into the corporate world for profit. And so it took some of those modeling of HMOs and some of the things that were there actually to help poor people have access to care, that those principles of efficiency begin to be corporatized. And now physicians as well as patients become numbers. You only spend 15 minutes now, because if you do that, it impacts our bottom line. So all of that begins to trump our attention to science, because now also Big Pharma. Big Pharma wants to get that bullet, and sometimes let's just say their return on investment is on that bullet instead of public health. And that's why we have increased prices. And so corporate medicine and the politicization of healthcare delivery, to me, has some elements that will help us understand why we have doubts and why we have people like cardiologists trying to tell a virologist that their stuff is wrong. Or you have a physician who's in the emergency room who tries ivermectin, and he sees a few of his patients that may be getting better, but he doesn't fully test things like pre-existing conditions. Were they exposed to somebody with the flu? Did they have, and then they make these analyses on a few patients that may raise questions to ask more questions about, but to make statements and go on YouTube and say, now we have this new cure, that's irresponsible. And so I think we have these three areas that we really have to talk about my profession and their ethics.
Thank you, Dr. Lee. Dr. Alcindor, coming to you. So first question here, this might be a parent asking this kind of question, but let's say one is asking, my 8-year-old child has COVID, so should she get the Pfizer vaccine, or vaccine period?
So I want to say that the Pfizer vaccine is the only vaccine that's been approved for 5 to 11 years old. So that tells you one thing. And if you're 8 years old and if you've had COVID, you are recommended to get the vaccine. What we know is clear, that a natural infection does not give you the level of protection that you get from the vaccine. There's something else I want to talk about that we shouldn't overlook here today, and that is the history of vaccines. All parents that are out there tonight, you have children that go to public school. The state mandates children that go to public school to get vaccinated for many different illnesses. And the idea is that they've been vaccinating these children for many years, since they were 6 months old until they're 18 years old. You get 74 vaccinations in the United States since 2019. Vaccines have been safe and effective for decades. Because of vaccines, we live over 30 years longer than we did 100 years ago, in part to vaccines. Vaccines are the most highly scrutinized public health interventions we know. And the idea is when you think about vaccines, vaccines go through many different phases, 3 different phases of clinical trials. A data safety monitoring board looks over the data coming from those patients. And these people are not objective in so many ways. Then vaccines go to the FDA advisory committee that I've had the privilege of sitting on. These are about 20 different individual scientists that are experts in the field. After that, vaccines go to the FDA itself. And after that, they also go to the the CDC Advisory Committee as well. And then guidance from them, so vaccines will be put out and distributed to the public. So vaccines go through many things before they get into people. There were no shortcuts made with this vaccine. Things were done to make things go quicker because we simply could not wait and let people die if we went through the 12 to 15 years that traditionally takes to make a vaccine and get it approved and distributed. Can I answer your question again? Can
I
you say
think
your
that
question?
answered it and provided us with new information. So that was very helpful. So I appreciate that. Thank you so much. We have a lot more questions to cover here. Let's go back to Dr. Juarez. So second question to you, doctor. A parent may be asking, how and when can my child get vaccinated?
Great. So the vaccine for children, the Pfizer vaccine for children 5 to 11 was approved, got final approval by the CDC last week, and the distribution began immediately. So the vaccine is now available, although it may not be available in the quantities that we would like. So parents need to be patient. The vaccine was distributed, the first line of distribution was to pediatricians, again, pharmacies, and to federally qualified health centers or community health centers. So they got the first distribution. And I was talking to our vaccine people at Meharry, and their first allotment was 300 vaccines. So again, and they had run out and didn't have any more. So again, we're going to see this probably for the next week or two. Some of the vaccine providers will have a lot of vaccines, while others, don't get as many and may run out earlier. So again, in addition to those major healthcare providers, sort of the traditional providers, we are, again, as Tennessee SEAL and Meharry, we work with Vanderbilt, other partners that have mobile vaccine units. We will be getting vaccines shortly, and we will be out at community sites, churches, and other organizations and community events making the vaccine available so that we're bringing it to communities. We have a lot of our, again, information. We generally have a table where Tennessee SEAL has healthcare professionals there to answer any questions or address concerns that people will have. We have vaccine testing, COVID vaccine testing, and then we have vaccine providers. So we try to coordinate our activities with many of the, again, community events that are going on. For instance, this Saturday, we will be at Plaza Mariachi in Antioch from 1 to 4. We will have COVID vaccines available, COVID testing. We'll have panels to answer questions, in addition to flu vaccines and many other types of healthcare screening and health education services.
Beautiful. Thank you so much for that, doctor. All right, coming back to you, Dr. Lee. Let's see here. In terms of COVID-19, and maybe this plays a role, but what role, if any, does COVID-19 play in public perceptions of the healthcare system and its change, as well as the staff, the healthcare workers?
Well, the big thing to me is with the health equity piece, that it exposed really serious, disparities in healthcare. So we already knew they were there, but it got put on Front Street, where it cannot be denied that there's a problem here. But again, you have to look at what I like to call the context of how we got here. We didn't get here yesterday. There were policies, things like looking at decreased funding for federal agencies. And I'm going to say this may raise some issues here, but corporatization and the influence on even how fast things got done in the FDA, what was being placed on priority lists. Was it the public health thing, or was it that silver bullet to make the best return on investment? So we have to begin to take a look at all the things that bring about health equity. You could even say things like, and there was an expert, her name is Dr. Fullilove, who talks about the multiple displacement syndrome when it comes to gentrification as a health risk, because poor people have to move a lot Their lives are disrupted. So you have to look at the whole picture of why things happen. We can even say that certain policies around, let's just say, NAFTA and outsourcing and losing jobs and the great steel rust belt, all those things impact in a cumulative way over time, and we just need a spark like COVID to really expose what's going on.
Thank you so much for that. All right, Dr. Alcindor, back to you. Let me ask you this. Can you discuss the study that was completed that convinced the FDA to approve the Pfizer vaccine for emergency use in children ages 5 to 11?
So what they did is they took about 4,600 children within that age range, and they took about half of them, gave them the vaccine. This is referred to as the vaccine arm. And they took the other half and gave them a placebo. And then they asked the question, how many of these children will get sick with COVID over a certain period of time? And what they found is that the children in the vaccine arm, only 3 of them got sick. But the children in the placebo arm, about 16 of them got sick. So it was very clear to them that the vaccine offered a level of protection that was much better than the placebo arm, which was about 90.7% effective. And so that's pretty high for any vaccines. What we have seen with these mRNA vaccines is the kind of efficacy we have never seen before for the traditional vaccines. These mRNA vaccines will set a paradigm shift when it comes to development of vaccines in the future. Being able to develop a vaccine very quickly, you see what I'm saying? And we may see, probably in the next year, a combinatorial vaccine that will include on one mRNA cassette both the influenza virus antigen and the COVID-19 antigen as a single shot vaccine. What they're hoping for is the new innovation where the mRNA vaccines, and I shouldn't say new because the mRNA vaccines were developed about a decade ago. They have come into being, haven't been in people very much until now, but you can see that this was a very innovative step that turned out right for us in a lot of ways. And so you're going to see vaccines be offered in different ways in the future. And so I think this will be very important going forward.
Wow, thank you so much for that. All right, coming back to you, Dr. Juarez. Let's see here. So how does the vaccine for children differ from the vaccine for adults?
Sure. The vaccine for children is about 1/3 the dose of that for adults. It has to be administered with smaller needles. Again, the efficacy level of it or the effectiveness of it is pretty close to the same as that for adult, for the Pfizer. Again, as Dr. Alcindor said, it was about 91% versus 95% for the adult version. So it's a very effective vaccine. So in terms of our confidence in it, it is also is very high, and I think that parents should be confident that in getting their children vaccinated, that it will protect at a very high level. Now, we do know, though, that the COVID, we've experienced what we call breakthrough cases with the Delta variant, and they're much higher than they were from previous versions. So it's still, we're still going to see children and others and adults who get vaccinated who may experience symptoms of COVID, but what we know is that they tend to be much less severe. They result in hospitalization. It's very rare that they result in hospitalization or death. So again, it protects people. The vaccine wasn't developed to protect people only from getting COVID, but it was to protect them from the effects of COVID, the severe side effects or symptoms and hospitalization and death.
Okay, thank you so much, Dr. Juarez. Coming back to you, Dr. Lee. Let's see here. Let's go with this one. Do a true or false. So true or false, COVID-19 is going to be around for a while.
True. True. We're going to move, just like in some of the flus, from pandemic to being endemic. Endemic means it's just around, you're going to have to deal with it. So there's no way in the world that this big, huge exposure to COVID-19 is not going to be here as a long-distance runner. And so we're going to have to be ready to deal with the variants as the exposures, like any other viral issue. Other variants will be constantly being, let's say, evolving. We have to be ready. It's going to be endemic, and we're going to have different variants, and we're just going to have that kind of the public vigilance to it, to be on top of it.
Thank you so much for that.
I want to add something.
Sure, yeah, go for it.
And the reason being, I think it's important, is that we have a pandemic that's a pandemic of the unvaccinated right now. And the idea is that the evolution of variants that Dr. Lee is talking about will develop as long as there's virus transmission and virus replication. And the idea is that if we don't get vaccinated at the levels we need, and again, we don't even talk about herd immunity anymore. It's out of reach for some people. But when you look at adding 28 million new vaccine-eligible folks to the vaccine rolls, we have a challenge. Because we know that we have hesitant parents that are out there that may not be willing to consent for the children that are out there that need this vaccine. So we have to speak to that.
Yeah, thank you for that. We'll pass it off to Dr. Juarez here. So, Dr. Juarez, coming back to you. Does my child need to continue to wear a mask after they get vaccinated?
The answer to that is a little more nuanced, and the CDC recommends that children wear vaccines in public spaces, continue to wear them even after they get vaccinated. So again, it's not we're not trying to say the vaccine doesn't protect, but it gives you that extra level of caution about getting the vaccine. And particularly if you live in an area that has a substantial or high community level of vaccine. And all of Central Tennessee, I think, is at that level. So people who live in Nashville and the surrounding counties, even after your children get vaccinated, if you're in public spaces, certainly if you're traveling on a plane or a train, it's a federal requirement that you'll have to wear a mask. And so, again, some of those things will guide. But when you're with family, and particularly if everyone has been vaccinated, you can relax a little more and not wear the mask. But if you're in close contact with people that have not been vaccinated, even family members, it is still recommended that you wear a mask, that children wear masks.
All right, beautiful. Thank you so much for that. All right, let's go back to you.
I just want to say,
Yeah.
social distancing and washing your hands is a big part of this as well. We have to follow CDC guidelines for this to work for everybody.
Yes, thank you so much for that, Doctor. All right, Dr. Lee here. How has COVID-19, we kind of hit on this a little bit with you, but how has COVID-19 played a role in the move toward what's considered patient-consumer oriented care?
Well, there's a couple of other terms I like to use
Sure.
by integrated care. In other words, it demands that every aspect of the healthcare system work together. Public health to labs to pharmacy, big pharma. Everybody has to be in there together. And we have to look at those populations that are at risk and that we serve, and how to put all that together to help serve those, first of all, who are at increased risk. Now, everybody's at risk, but how to get it to those who are at most risk and coordinate that. We are all in this together. And so, whether you're dealing in as an ambulatory care, whether you're a doc or a school system, we have to keep each other informed. We have to continue to gather data. What's happening in the school systems, what's happening at work, right? And so all big systems have to look at it. What is my part to play in managing any major public health issue that comes along? It's just like when you look at disasters, like natural disasters, everybody has to come together. Sometimes the hospitals are knocked out. So what are you going to do? You're going to bring everybody who has healthcare skills or whatever to that. You have to have plumbers and folk have rebuild the hospitals. So you have to have everybody understand what is their role when pandemics, epidemics, tragedy that has public health implications. Everybody we have to work it. Politicians have to talk about what kind of policies that we put together in the health field and in healthcare to help us promote this kind of integrated approach and balanced approach to major public health issues.
All right, thank you so much, Dr. Lee. All right, we're ending out round two. We're going to end with actually Dr. Alcindor. So we'll have one more question here. We have phased out of round one, phasing out of round two. As you've been listening, maybe some of your questions haven't been answered, even from Meharry Medical College through the litany of questions that I've asked. So if you have additional questions you would like to hear covered live tonight, please send those in right now. We're going to transition into round three, which is the audience questions. So last question for you, Dr. Alcindor, before we start round three from the audience. Will the COVID-19 vaccine be included among the regular childhood vaccinations in the future?
I think so. And I think this virus will be with us for long enough for that to happen. And I think that children will continue to be a source of transmission. Because whether you like it or not, all children will not be vaccinated. There are a lot of parents. When we think about this, there was a poll done. Only 27% of parents wanted to vaccinate their children right away. On top of that, a poll done, 78% of all individuals have some level of misconceptions about the vaccine. We have to work hard to clear this up. And so I believe that it will be. And so when we go back to vaccinations, there were a time in this country going back to the 1850s where there was compulsory vaccinations, meaning that you had to be vaccinated, your child had to be vaccinated before it was 3 months old, or you could be fined or in prison as a parent. Those days will never come again. But what we've seen is that when vaccinations are done at the level that they need to be, they make a change for the public that's a benefit. And we need to get there.
All right, thank you so much for that, Doctor. And thank you, doctors, for round one and round two. So round one was for Vanderbilt, and it was all things related to the flu and the flu vaccine. Round two followed that up with Meharry Medical College. We've just discussed several items, new information from me as well around COVID-19 and vaccinations in general. We are now stepping into round three. I have a couple questions that have come in already from the audience out there. And this is going to be a just a quick little hot grab. So whoever wants to take the question can take the question and answer the question as we wrap up these last 10 minutes here. So one question that comes in from one of the audience members is it okay to receive the COVID booster vaccine with the flu vaccine? If not, what is the length of time one should wait?
You can get both of them. And again, you have to be eligible, but you can get both of them at the same time. As children, oftentimes children in pediatric clinic will get multiple vaccines at the same visit.
We have a limit of 6 sticks, and that's just a nursing limit. There's no real, scientific reason for that, but that's what our nurses say, max of 6 sticks.
And again, if you're getting multiple vaccines as a child, children are very, sometimes they're scared. And it's recommended that you give them the vaccine in different places on the body. The arm, if it's too much, then the thigh. And of course, children that are squeamish should be put in a chair and calm down or lying down to get these vaccines. So I would say to all parents out there, prepare your children to receive the vaccine. Bring their favorite toy with them. Sit down with them and talk to them. Sometimes you have to distract children in order to get them to take a vaccine. So it's a process.
All right, thank you so much for that. Any other audience questions here? All right. It says here, can I get the COVID vaccine even if I've had COVID-19?
Yes. Again, it is recommended that people get the vaccine even if they've had COVID previously. And the reason is, again, and Dr. Alcindor mentioned that earlier, the vaccine is more effective in terms of protection than getting COVID, the response to COVID. So again, people, if they've had COVID, still need to get vaccinated.
All right. I think that's all the questions that came in. Oh, one more coming through.
If I'm pregnant, should I receive the vaccine?
Okay, so the question is, if I'm pregnant with child, should I receive or should I get the COVID vaccine?
Absolutely. And again, gynecologists, OBGYNs will recommend pregnant women to get the vaccine. A pregnant woman getting COVID and not being protected with the vaccine can have severe disease that can have complications for both her child and herself. And it goes, pregnant women that don't get the vaccine and get COVID have a higher risk of developing severe symptoms, ICU, hospitalizations, and complications for their baby.
I'd just like to add, I'm working in a newborn nursery this week, and so right now COVID levels are lower than they were last time I was in the nursery, but I had multiple mothers in 1 week who had to come in and have an emergency C-section or be induced for their birth early because they were so sick that they needed ICU care with COVID. And so then we had their baby, the mom's in the ICU. The dad couldn't come into the nursery to see the baby because he was exposed to COVID. I mean, it's a horrible situation and it's really terrifying. So I would encourage all moms who are pregnant to please protect yourself because it's really happening out there.
I just want to add to that that if you're a mother and you get the vaccine, there is evidence that the antibodies that the mother produces is transferred to the child. Okay? So again, added protectant for the child for COVID.
Okay. And another question, and we'll say the final question here. Can I choose which COVID-19 vaccine I receive?
Yeah, the answer to that, it depends on what age you are. If you're a child, it's only available, Pfizer is the only available vaccine right now. For adults, you can choose. It just depends. Not all providers carry all three vaccines. So you may, if you go to a particular provider, they may only have one vaccine. Partly because storage, partly because of distribution, different things like that will affect it. So at Meharry, we do offer all three vaccines, the boosters, I'm sure, and the child vaccines now.
I want to just add one little thing. Yes. From 5 to 17, Pfizer is the only vaccine you can get. 18 is when Moderna and Johnson & Johnson becomes applicable for vaccination.
All right. All right, thank you so much for that. Everyone, that wraps up round 1, 2, and 3 here. We appreciate the audience, the viewership, and thank you so much to our panel, our experts on tonight from Vanderbilt Children's Hospital, as well as Meharry Medical College. Again, I'm Eric Cox. I'm the Director of Outreach here at Royal Oak Community Church, and we have conducted the Health Equity Initiative Q&A session. This is a 2-part event, so tonight was the Q&A session with the experts in the field. This coming Saturday, we will follow this conversation up with on-site vaccination offerings, one with Vanderbilt Children's Hospital in the mobile flu van in the parking lot of Royal Oak Community Church. We're located here at 2311 Murfreesboro Pike, Nashville, Tennessee, 37217. That will be from 10 a.m. to 2 p.m. So that is Vanderbilt Children's Hospital for the flu vaccine for ages 6 months to 21 years of age. Last plug here for these free diapers. You get free diapers if you bring your young ones out, bring your little ones out, get vaccinated, get free diapers. And then Nashville Public Library will be here, and they will be providing a story time during that period as well. We'll also have Meharry Medical College staff here inside of the building providing the COVID-19 vaccinations. We will provide 2 vaccinations on this coming Saturday, so the offerings will be Johnson & Johnson and Pfizer. So Johnson & Johnson and then Pfizer. Any last words before we wrap up this session? We got a couple minutes here, so if y'all want to, any last impressions?
Just one more thing that what we'll have on Saturday is we're going to have prizes for the kids, snacks for the kids, and Chick-fil-A sandwiches for the family.
Okay.
So.
And I just wanted to add that, again, if you want further information, we have a wealth of information, a lot of flyers. We have 20-some flyers in English and Spanish on our Tennessee SEAL website. It's tnceal.org. We try to keep updated information. It's a source of, again, we go to CDC and the other, Johns Hopkins, other sources of trusted information to put that information there. In addition, for those that live in Nashville and have children in the public schools, they are offering, Nashville public schools are offering COVID vaccines for children on Monday, Wednesday, and Fridays between 3 and 6:30 p.m. At different schools, so they're rotating. I believe this Friday it's going to be at Pearl-Cohn and I forget the second.
I know it's Pearl-Cohn, but
No, it's not Cambridge. But they are scheduled. You can go to the Nashville Public, the Metro Nashville Public School website and find out where those will be. Again, they're Monday, Wednesday, and Friday from 3 to 6:30. And we also have them in Meharry. We have a stationary vaccine unit there. We also provide vaccines at, what's the site? Down on, gosh, I'm blanking on the name. But again, if you go to the Meharry website, you can find out where vaccines are being offered.
I just want to make one statement. I want to say that for 5 to 11 years old, this is a 2-dose vaccine, so it's very important that parents make an appointment to get the second dose for their child.
All right, thank you. And then, Dr. Lee, any final words? Got a minute here.
Yeah, I'll just say, let's say science and evidence-based compassion so that we can conquer this thing.
And I appreciate you each and all. Thank you again to the viewers who are tuning in. Please share. These will be made available through YouTube and then also Facebook Live. So share once you see it. I'll of course share it with you all to share these links. So the information is very empowering. So thank you all for the information that you provided on tonight. And again, if you've already received a vaccination, please share this with those who have not, so they can get out here, receive these free offerings, and make good health decisions for themselves and the community. That is all from Ray of Hope Community Church. Be blessed.